Certainly, I think diet is important in acne, and in the early, probably before the 60s, it was felt that diet was a significant factor in producing acne problems. But in the late 60s, early 70s, there were two studies that came out suggesting that there was no association with diet and acne. And that idea carried through for about 40 to 50 years. But then in the last decade, there's been changes. There have been several studies showing that diet probably does have a significant effect on acne. It's been shown that patients who have a low GI diet, low GI load diet, can have less acne and can make a significant difference in their acne. So, as you know, GI, it's a matter of actually working out what your different foods have. So it's been shown in studies now if you have a high GI diet, that can actually give rise to increased insulin in your system, and that increased insulin can therefore increase your masculinizing hormones and other mediators in your body, which then can give rise to an increase in your oil gland production and also blockage of the oil glands, all leading into more acne lesions. As we know, there's a group who feel that milk, particularly skim milk, can have a significant effect on your acne production. So if you reduce your milk amount of milk you have, and particularly skim milk, that can actually reduce your acne. But if you reduce milk, you've also got to then think about calcium intake. So if you reduce your milk, you drop your calcium intake, and then you're going to have to get that calcium somewhere else, be it in your diet, by eating different foods which are higher in calcium, or by having a calcium supplement. Diet is only one factor in controlling acne. You also have to look at other treatments. So if you may need to actually have topical therapies or oral therapies. In that case, you'll need to see your doctor, be it your GP, and if the GP is concerned, they may refer you to a specialist, i.e. dermatologist, for management. And so with oral therapies, with topical therapies, you'll be looking at various creams, lotions, washes, and then with oral therapies, they'll be looking at various antibiotics, hormonal manipulation, and possibly isotretinoin if your acne is quite severe.